What if I told you there's a natural alternative to metformin that could potentially help manage your blood sugar just as effectively, but without the side effects? What if I told you that many doctors either don't know about it or simply aren't sharing this information with their patients? Welcome back to Health Treatment Center, where we uncover the health solutions that truly work. I'm about to share something that could completely change how you approach diabetes management. But first, if this is your first time here, make sure to subscribe and hit that notification bell, because we're constantly revealing breakthrough health information that could transform your life. 3 months ago, I received an email from Sarah, a 54-year-old teacher from Ohio who had been struggling with type 2 diabetes for over 8 years. She'd been on metformin for most of that time, dealing with the digestive issues, the constant stomach upset, and despite her best efforts, her blood sugar levels were still inconsistent. But what happened next changed everything I thought I knew about natural diabetes management. Sarah discovered a compound that's been used for centuries in traditional medicine, but has only recently been studied extensively by modern science. Within 60 days of incorporating this natural alternative into her routine, her HbA1c dropped from 8.2 to 6.4, and she was able to work with her doctor to gradually reduce her metformin dosage. Now, before I continue, let me be absolutely clear. I'm not telling anyone to stop taking their prescribed medications. This information is for educational purposes only, and you should always consult with your healthcare provider before making any changes to your treatment plan. If what I'm sharing so far is making sense, type learning. In the comments right now, I want to know how many of you are dealing with similar challenges. The compound I'm talking about is Berberine. And here's what makes this so incredible. Multiple clinical studies have shown that Berberine can be just as effective as metformin for managing blood glucose levels. But it works through different pathways in your body. Here at Health Treatment Center, we've been following the research on Berberine for years, and the results are remarkable. One study published in the journal Metabolism compared Berberine directly to metformin in 116 diabetic patients. The results: both groups showed similar improvements in blood sugar control, but the Berberine group experienced fewer gastrointestinal side effects. Stop for a moment. How many of you watching this have experienced stomach problems with metformin? Let me know in the comments, because you're definitely not alone. But here's where it gets even more interesting. Berberine doesn't just help with blood sugar. Research shows it can also support healthy cholesterol levels, promote weight management, and even support cardiovascular health. It's like getting multiple benefits from one natural compound. The reason many doctors don't know about Berberine is simple. It's not heavily promoted by pharmaceutical companies because it's a natural compound that can't be patented. There's no financial incentive to educate healthcare providers about it, even though the scientific evidence is compelling. Now, I want to share with you exactly how Berberine works, because understanding this will help you have an informed conversation with your doctor. Berberine activates an enzyme called AMPK. Think of this as your body's metabolic master switch. When AMPK is activated, it helps your muscles take up glucose more efficiently. It supports your liver in producing less glucose, and it can even help improve insulin sensitivity. This is why the effects are so similar to metformin, but achieved through natural pathways. If you're still with me and you're serious about exploring natural health options, comment committed below. I read every single comment, and I want to know you're taking action. The typical dosage that's been studied ranges from 500 milligrams to 1,500 milligrams per day. It's usually taken with meals to improve absorption and reduce any potential stomach upset. But remember, dosage should always be determined in consultation with a healthcare provider who understands your specific health situation. Sarah, the teacher I mentioned earlier, started with 500 milligrams twice daily with meals, always under her doctor's supervision. She monitored her blood sugar carefully and kept detailed records that she shared with her healthcare team. This collaborative approach is exactly what I recommend. Here's what Sarah's 60-day journey looked like. Week 1 to 2, she noticed improved energy levels. Week 3 to 4, her morning blood sugar readings started stabilizing. Week 5 to 8, her post-meal spikes became much more manageable. And by day 60, her HbA1c test showed that dramatic improvement I mentioned. But Berberine isn't just about blood sugar. Sarah also lost 12 pounds during those 60 days without making any other significant changes to her diet or exercise routine. This is because Berberine can help support healthy metabolism and may reduce the storage of excess glucose as fat. Now, I want to address something important. While berberine is generally well tolerated, it can interact with certain medications, particularly other blood sugar lowering drugs. This is why medical supervision is crucial. AM people also experience mild digestive upset when they first start taking berberine, which is why starting with a lower dose and taking it with food is recommended. Before I finish, I want to hear from you in the comments. What's been your biggest challenge in managing your blood sugar? Have you heard of berberine before? Why our experiences help our entire health treatment center community learn and grow together. The research on berberine is extensive and growing. There are now over 2,800 published studies on berberine and its health effects. Major medical institutions are taking notice, and more doctors are becoming aware of its potential benefits. If you're considering berberine, here's what I recommend. First, do your research. Look at the clinical studies. Second, have an open conversation with your healthcare provider. Bring them information about berberine and discuss whether it might be appropriate for your situation. Third, if you decide to try it, monitor your results carefully and maintain regular communication with your medical team. Remember, at Health Treatment Center, we believe in empowering you with information so you can make informed decisions about your health. We're not here to replace medical advice, but to help you discover options that might enhance your wellness journey. Don't forget to subscribe to Health Treatment Center for more breakthrough health information. And if this video helped you learn something new about natural health options, please give it a thumbs up. It helps us reach more people who need this information. Your health is your most valuable asset, and you deserve to know about all the options available to you. Until next time, keep exploring, keep learning, and keep taking charge of your health naturally.